Happy Migraine Awareness Month, everyone. Now, if you're a bit like me and the body doesn't behave as it should be, you probably should think about adding a physio to your care team. I know that sounds a bit weird. We're talking about something happens in the brain. Why would you use a physio? Well, to help us talk about that, we've got Rachel Forlonge. She's a physiotherapist at Neurolink Physio in Perth. Thank you so much for joining us, Rachel.
Thank you so much for having me, and happy Migraine Awareness Month, everyone.
Happy Migraine Awareness Month to you as well. Now, let's start at the very basics. What does a physiotherapist do?
So a physiotherapist essentially looks at different body systems and tries to help prevent or treat different conditions that affect people's bodies. So that can include things like muscles and joints. It can also include neurological things, so helping with neurological conditions that affect the brain. And that's where migraine comes in.
Okay, so what can a physiotherapist do for somebody with migraine?
So essentially with physiotherapy and migraine, what we're looking for first and foremost is to help with flagging, is this person actually suffering from migraine? I find a lot of the time people are coming to me and they don't realise that that's actually what's been going on. They've probably never even heard of migraine other than the typical classic migraine symptoms that we get. And if they don't fit into that box, then often they get missed. So I think the primary role is trying to pick up on, is this a possibility that someone might be suffering from that? Then on the other end of the spectrum, if we know that you have migraine, there are some different ways that we can help. So education is a big part of my role, education on, what is migraine and what are some of the things that you can do both lifestyle wise and trigger management wise to help deal with your migraines. And then there are some other things that we might include. So for some people, their neck can be a big contributing factor. Not for everyone though. If that is, we'll have a look at your neck and treat what might be contributing there. And I think the other big role that we can have is for other symptoms of migraine that people don't often associate. So dizziness, hemiplegic migraine, people might have imbalance or they might have weakness. So those are some of the things that will help to treat with some exercise therapy.
And when you're talking about migraine going undiagnosed, it is often our friends with vestibular migraine who get missed because they don't think for a second that these constant recurring episodes of dizziness and other vestibular symptoms could be migraine. How important is the physiotherapist in caring for somebody with vestibular migraine?
I think it's really important. I think, unfortunately, vestibular migraine is not really well recognised in the general medical community, and it can often be misdiagnosed. So in my experience, a lot of people come in, referred by their GP or through word of mouth or even by their neurologist or, some throat specialist because they're not sure what might be going on. And they're wanting to then rule in and rule out other vestibular causes. So, is this actually coming from the inner ear or is there something else going on here? And that's where I think a lot
very difficult to kind of manage vestibular without a physio because you are largely dealing with dizziness stuff. But if we talk about me for a moment, so I have hemiplegic migraine, and obviously with hemiplegic migraine, you're dealing with significant bouts of weakness, muscle weakness, usually on one side. That's that stroke-like presentation. So is there much that can be done by physios for, working with all of those muscles that are numb and weak or, often get weak? Like if somebody has an attack that kind of routinely takes out their left arm, is there much that can be done in kind of strengthening that left arm?
Yeah, definitely. I mean, one of the ways that I really liked a neurologist to speak about migraine, so I guess we can relate this to hemiplegic migraine, would be you have the attack. So it's like that fire going off in your brain. And as part of that, you get acute weakness. But then you might be left with the embers or the coals that are still lingering. So the attack's passed, but that doesn't mean that your muscles automatically become strong again. And that's where some exercise therapy to help get some more sensation and strength back into those muscle groups to help keep you as strong as you can between attacks is really important.
And are you able to work kind of directly with neuros in managing patients, or is it kind of like a secondary thing?
Good question. I think we work hand in hand, but really at the end of the day, it needs to be directed by their neurologist. So I'll have patients who are directly referred from their neurologist and recommended to come and have physiotherapy. And then I'll have other patients who have sorted out from maybe their GP or word of mouth, and we'll work alongside the neuro in those cases.
Alrighty. As my puppy dog comes in and wants to crash the interview, what is your best tip for somebody that might be thinking about adding a physio to their care team? What should they do?
Yeah, great question. I think it's about finding the right person. So I think it's really important that you ask the question from your local physio, or do a little bit of research. Do they have some experience in migraine? Have they seen people with migraine before? And particularly if you know what type of migraine you have, is that something that they're familiar with? So for example, as a hot tip, if you're a dizziness migraine sufferer and you've got vestibular migraine, you really want to see somebody who knows what that is and is experienced in treating those things.
Really great tip. Thank you so much for making the time, Rachel, and happy Migraine Awareness Month.
Happy Migraine Awareness Month. Thanks for having me.